Kennedy Masime, who is Executive Director of the Centre for Governance and Development, joins us for a look at the economic and social prospects for Kenya following that inauguration. Good morning, Kennedy. Now, it all sounds grand with the ceremony, of course, and with the new constitution, but it does provide for specific provisions in the cabinet in terms of numbers of ministers. So it looks as if some people who are in will have to go out of the inner circle of the president's people.
Good morning. Yes, the appointments will be governed by the Constitution of Kenya 2010 that ushers in two different aspects. One is that cabinet secretaries will be appointed out of parliament, and two is that there's a limit to the number. It's between 14 and 22. So basically, Kenyans are expecting a technocratic cabinet made of professionals.
Now, Kennedy, that sounds good in theory, but in practice we have individuals here who have access to office, and office brings with it patronage in any kind of governmental system. So there's going to be a lot of competing here, and the stakes perhaps quite high for some individuals. How's it going to work? Is there going to be stress within the ruling elite?
Yes, the competition for cabinet posts will be very stiff, but actually that will signal the intentions of the government in terms of how serious are they about change and how serious are they about what they are claiming, that this is a change government, that they are supposed to be a generational change. So it will signal the kind of leadership that we should expect in terms of the people that will find their own names in the cabinet.
When it comes to the structures of government too, there's more decentralization, regions are being given more power, but that also can't be done at the stroke of a pen. There's going to have to be a reallocation of resources, reallocation of budget, reallocation of people.
Yes. Yes, now at least as per the constitution, the central government is supposed to spend at least 15% of the national revenue on county budgets. The Jubilee government has promised 40% in 5 years' time. But of course, starting from now, there will be a bit of a tug of war because the counties want more. The central government also wants to have a bit of control. But we hope that this will work out eventually.
Well, who controls the budget, I suppose, controls the politics, and it'll be interesting to see how that develops. Now, some promises have been made, and we know that Kenya has seen some good economic growth. There is a sense of stability although the election was contested, the court ruled in favour of it, so it's now been confirmed. But some promises have been made. Maternity fees in government health facilities to be abolished. Children starting primary level education, all to have computers. Is this feasible?
In terms of the budget, it's feasible because the amounts can be raised. The issue is sustainability and whether these are a priority. Let me start by the issue of maternity. Currently, the government hospitals charge about 4,000. So if you do the mathematics, about 1 million Kenyans are born every year. So that comes to about 4 billion. That's feasible. But the issue is, if you make it free, are the facilities adequate? Is medicine there? Are there enough personnel? You make it free. Even now, it's basically affordable. But normally, people go to government hospitals as a zero option because they can't afford the other one, because the service is very poor. So one would have expected the service to be improved before you talk of making it free, because you can make it free, but what are you offering in the first place?
Do they have the capacity to do this in all places? I mean, it's one thing to have the money and another to have the principle. When will it happen? When will every person who could be affected by it benefit?
The president promised within 100 days. So what I'm saying is that they can avail the money. Yes, it can be free, but the facilities are in a dilapidated form, in the sense that if you go to a government hospital now, the services you get are very poor. You know, ladies who go there to deliver share beds, and it's very poor service. So the issue is to improve the service part, recruit more nurses, pay them better so that they can have the motivation to work before we talk of making it free. Because you'll make it free, but it'll be free. What are you offering? That's the question I'm asking in the first place.
Let's look at the new president's foreign policy. The domestic issues have been preoccupying him, understandably. President Jacob Zuma from South Africa and Jonathan Goodluck from Nigeria at the inauguration. What are the senses of partnerships, investments, and general relations between the big countries in Africa?
So far, so good. Of course, there's economic competition between them, but in terms of diplomacy, I think they enjoy good relations so far.
Do we expect more of an outreach from Kenya now that the domestic issues have been settled? Certainly for the last 6 months, it seemed to us, talking about it from the outside, that there has been a domestic preoccupation.
Yes, and if you listen to the president's inauguration speech, I think he tended to emphasize on Pan-Africanism. That means trade within Africa and more cooperation within African countries. He was very strong on that.